The growing mental health crisis in Western New York comes with challenges. Nobody knows that better than the Erie County Medical Center, the region's biggest and busiest full-service psychiatric emergency room.
It's an important subject News 4 Investigates reported extensively last year. They're now taking another look to see what has changed and improved. Luke Moretti reports.
When it comes to Erie County Medical Center's psychiatric emergency room,
there's clearly more work to be done.
That's Mark O'Brien, Commissioner of Erie County Department of Mental Health. What does the hospital's Vice President of Behavioral Health Services say about that? You agree?
Absolutely. And I hope we never say that we're satisfied with everything going on. We're going to constantly look internally at what we can do to improve our processes and make things better.
It has been a year of change for ECMC's Comprehensive Psychiatric Emergency Program, known as CPEP. And that includes newly created positions held by Ronald Scholerman and Michelle Say. Scholerman is Vice President of Behavioral Health Services, and Say is Assistant Vice President of CPEP. Both agreed to sit down with News 4 Investigates.
Communication with family has improved. We've the families that are in house, they're here waiting with their loved ones. We've added rounding so that someone will come out frequently to see if there's anybody that has any questions or have they been taken care of.
The communication piece is huge for Laura Shriver Brown, whose husband Jeff required mental health treatment at ECMC in the past. She's been advocating for change in the way families are treated as they wait outside the walls of CPEP.
There was no one to comfort me. There was no brochure to read. There was no resource, no appointment I could call and set while I'm sitting there for hours and hours just to get an answer.
Another issue raised by former CPEP patients is the wait time.
There was just a lot of waiting.
This is Jessie, a 17-year-old who's been to CPEP multiple times as an adolescent, most recently about a year ago.
When you'd first go there, you had to wait for like 3 hours. Until they would actually say, okay, we have enough space upstairs, you can go upstairs. Or, well, not upstairs, upstairs to CPEP. Because CPEP was on like the second floor. And then you'd be, at CPEP and stuff and just kind of sitting there waiting.
Hospital officials say there's a process. Patients are first evaluated in the medical ER before going upstairs to the CPEP triage area, where they will be seen by a psychiatrist right away, according to Scholerman.
Doctors are seeing those patients
right away
upon arrival, right? And then the secondary review is once they're then into our care areas.
He says the wait time for that secondary review by a doctor in CPEP is normally about 24 hours.
And again, I understand the narrative that you might get from different members about, the time or not knowing they saw a doctor, but they are being assessed at all points.
Jessie's mom, Lisa, felt as though her son was discharged too soon during one of his CPEP encounters.
I was concerned because I felt that he needed more care. I feel like this is the big issue in this area. There's not enough stable mental health places for these kids. It's always overcrowded. They're always waiting around, waiting to get a room, waiting to be transferred.
I feel like it kind of makes you worse.
Emily Leskowski has been to CPEP a few times over the years. The 25-year-old sat for an interview with her parents. This is how she described the experience.
You're kind of in there on your own and you're left to fend for yourself, and don't ask the staff questions because, some of them are nice, I will say that, but, you go to knock on the door at the nurse's station and they'll just ignore you.
Emily's father, Jim Leskowski, says based on his daughter's past experiences and stories, he avoids taking her to CPEP.
I know myself, when Emily's in crisis now, we'll drive an hour and a half to the southern tier to take her to get help before we will go to ECMC.
Emily's mom feels the same.
I don't know how to fix it. It needs to be fixed. And it needs to be fixed for those people that can't speak for themselves, are in crisis and can't speak for themselves.
Hospital officials say while they're always looking for ways to improve, providing a safe environment for patients and staff is a top priority.
There's guidelines that the hospital has to follow, so it's finding that balance between that and what we can provide. So certainly there's those areas where your staff is behind the glass window or door, but we are and continually are working to have people out in the care area, be present with the staff, or have the staff present with the patients and available and accessible to them.
Erie County Department of Mental Health Commissioner Mark O'Brien,
We looked into it.
says ECMC CPEP has made changes over the past year, like leadership, staffing, and using a data-driven approach to assist in managing care. He says the hospital deserves credit for that and for being engaged with community stakeholders, including government regulators, former patients, and family members.
It's a very active partnership to address these issues. Are they all where they want to be? They'll be the first to tell you no, but in my assessment, there's been a lot of improvement made.
One big improvement being proposed is the reconfiguration or modernization of CPEP. The hospital believes modifying the physical plant would improve workflow and ultimately increase efficiency. But it's just a proposal on paper, and as of right now, going nowhere. Why is that? We'll explain in our next report. Luke Moretti, News 4.